Diagnosing CIRS requires a combination of multiple objective tests and can only be made by a doctor that has received training in the Shoemaker protocol, which is the only science-based protocol that has been shown to reverse CIRS. Doctors first need to rule out any other illnesses, and this is important because CIRS overlap with many other illnesses. This initial screening includes a thorough assessment of the patient's personal and medical history, including standard blood work, physical exams, and lab tests. The personal history is extremely important to determine whether the patient has had exposure to water-damaged spaces, tick bites, spider bites, or fish poisoning. Patients then usually do a visual contrast sensitivity test together with a symptom cluster questionnaire. If patients fail both of these, there's already a 98.5% chance of having CIRS. Then they move on to a CIRS blood panel, where we can confirm whether the patient is genetically susceptible and whether the abnormal pro-inflammatory markers are turned on. This is usually sufficient to make the diagnosis, but patients can also choose to do a NeuroQuant MRI scan to look at brain abnormalities, and patients can also do a blood test called GENIE, which measures abnormal gene activity that becomes present in CIRS.